Group Head Medical Strategy and Operations from Fortis Healthcare. We are having a very interesting session on emergency medicine. Being live telecast on various platforms, and people will be wondering why we are talking about emergency medicine. As a healthcare provider from Fortis Healthcare, we put a lot of emphasis on emergency medicine because this is something that needs immediate care, because these are patients who come for various illnesses, injuries that require urgent attention, and it is required 24 by 7, 365 days a year. So that is something that we are focusing on. And today we have a very august panel of three important senior emergency medicine physicians from across different networks of our setup. One is Dr. Sandeep Gore. He heads our emergency medicine. He's the director and HOD of Fortis Mulund, which is in Mumbai. It's a major facility that is west. Then from east, we have Dr. Sanjukta Dutta. She heads the emergency medicine at Fortis Hospital, Anandpur, Kolkata. So Pura Paschim. Now I come north to the Shalimar Bagh, which is in northwest Delhi, which has become famous. Many of you will be knowing now that the present Chief Minister of Delhi belongs to the Shalimar Bagh constituency. So that has got a lot of attention. And Shalimar Bagh is one of the major hospitals of our Fortis network. And it has probably one of the highest footfalls of patients coming into the emergency medicine. And here, Dr. Mashhad Rizvi heads it. So we'll be asking questions to all the three panelists, and it is basically to sort of educate the public on how do you look at cases where illnesses happen, injuries happen, and emergency medicine is a port of call. So I'll start off with Dr. Sandeep Gore from Fortis Mulund. Sandeep, welcome. So
Thank you, sir.
I'll ask you two questions, and then I'll go to the other panelists. Is that in layman terms, to explain to the public at large, what exactly is the medical emergency, and how can you quickly identify? And the
Yeah,
second question
medical emergency is a sudden illness or injury that poses immediate risk to life, long term or short term, and it affects the well-being of the patient if not treated timely. So this is based upon time-bound care. We have to act within a given timelines. So what kind of medical emergencies we can face? A patient with a chest pain is emergency. A patient with breathing difficulty is emergency. A patient sometimes experience sudden weakness on one side or altered sensorium is an emergency. Unconscious patient who is not responding to call is one of the emergencies. Patient is feeling dizzy and profuse sweating, that is one emergency. Seizure, choking, and allergies, or we can say if blood pressure is very high or very low, or heart rate is very high or very low. That also we can say that one of the presenting factors of the emergency. So in emergency, that it's a sudden illness or it's an injury that poses immediate risk to the life or limb, and it will make a long-term harm to the patient if it's not treated within a given time.
and Sandeep, follow up of that question is एक important जानकारी जो public को होना चाहिए is that what is the golden hour, because this is something very crucial that the public and at large must be aware of, so that they can avail emergency services at the earliest. So the golden hour, if you could explain it in layman's terms so public are aware.
Yeah, and golden hour, yes, it's a very nice question, sir. People should be aware about this golden hour, and golden hour concept is not just limited to trauma. Golden hour is the first 60 minutes of any injury or illness, where we have to do the give the medical care. That it will help in three ways. It will prevent the organ damage, it will stabilize the vitalness, and it will reduce the complication. So golden hour means first 60 minutes. What we do a patient when the patients come to emergency department, A patient can be in a trauma, a patient can be in acute severe illness, patient can be on a septicemic shock, or patient presented to emergency department with undifferentiated breathing difficulty and cardiogenic shock. So the concept of golden hour care has been quite revolutionized nowadays with advent of point of care ultrasound in emergency department. It will in golden hour will able to know exactly what's exactly going wrong in the patient. And we can do the necessary interventions based upon the clinical finding. So, golden hour is the care which emergency medicine doctors delivers in a patient who are presenting to emergency department in case of injury or in case of medical crisis within first hour.
Thank you, Sandeep. And I come to Dr. Sanjukta because you are also in Anandpur, Kolkata. You are a busy cardiac unit. You get a lot of heart attack patients who come for treatment. So, an important thing is what is the message that you want to give to the public at large? What are the warning signs of a heart attack you should never ignore?
Yeah, this is a very important question, and the people come to us at times. They ignore the symptoms of heart attack and they come late. And for us also, even if we do everything, it is very difficult to save that heart. And there are some instances where there is nothing, but they think that they are having heart attack. So you just remember that there is a heart attack, there is a typical pain. So it is usually a heaviness on the chest, it is a squeezing or pressure that feels like a pressure. You cannot really point it out with one finger that I am having pain over here. It is a pain, it is all over, and it might go and radiate to both the arm, shoulder, back, neck, jaw. So if you are experiencing this kind of pain, and it might be associated with profuse sweating, shortness of breath, at times fainting, uneasiness. So, shortness of breath, do not ignore these signs and symptoms. These could be pain of heart attack. And also remember this, that during heart attack, again, as was the previous doctor was saying, the golden hour is very important. You need to act immediately, because you do not call the fire brigade when the fire is already spread. So you act immediately. Here also you need to rush to an emergency department which has got all the facilities to detect the heart attack, diagnose, and it should be backed up by a cath lab 24 into 7 who can do the angiography and angioplasty immediately. Because what happens in heart attack is there is a block in the vessel which is supplying the heart muscle, and the heart muscles are dying every minute, every second. The muscles are dying, the muscle cells are dying. So you understand, if you are there is a dry plant, immediately after a couple of hours, if you give some water, you might get the plant back. But after 2 days, if you give water on that plant, it will never come back. So heart is also like that. If you lose time, the cells are permanently gone, the treatment will be futile. So these are the warning signs, that the squeezing, pressure, shortness of breath, fainting. So please look carefully. If you find this, please get checked. It is better to be checked and find nothing than not checked and be gone.
Thank you, Sanjukta. And now I'm coming to Dr. Mashhad. Is something is that stroke is something that all of us are aware of, and it is a concern because it has a lot of debilitating post effects after a stroke. And it is not only the patient, the family members, the caregivers, they also suffer from this. So it is important that we need to look at stroke in a very positive way and see that how do we catch them early. And so, Mashhad, I'm asking is that how can you recognize stroke symptoms and act fast to save a life?
Thank you, sir, for this important question. Definitely, it affects around us. And as Dr. Sanjukta was talking of the heart, same applies to the brain as well. I mean, time is brain. So it's very important for all of us, for the community at large, to understand how to immediately recognize the stroke. So it's very easy to remember. We can remember the acronym Be Fast. We can summarize the indications, the symptoms with this acronym Be Fast, where B stands for balance. I mean, if you find unsteady gait, or you find sudden loss of balance, you are not able to walk, imbalance, you should think that it might be stroke. Where E stands for eyes. If you feel there is some diminishing of vision or some blurring of vision, you should think of stroke. Where stands for face. If you feel some numbness over your face and any side of your face, you can simply see yourself in mirror, try to smile. If you find asymmetry in your smiling, or your droop on one side of face, it consider it as stroke. Where A stands for arm drift. Raise your both arms. If one of your arms is drifting downwards or is not able to hold simultaneously, it means consider it as stroke. Where S stands for our speech. If you are not able to speak clearly a simple sentence, or you're in layman term, अगर आपकी आवाज साफ नहीं है, वो slurred है, तो इसको हम consider करें stroke. T stands for time. Time means time to act fast. Time means time of onset, कब शुरू हुआ, because that's very important. अगर ये याद नहीं कि वो कब शुरू हुआ, so the important is कि last कब आप बिल्कुल normal थे. That's important. Why we are talking of time? Because we have now, as the advancement of the drugs, advancement of the science, अभी हमारे पास क्लॉट बस्टिंग ड्रग्स हैं, बट उनकी एक लिमिटेशन है कि हम वो सिर्फ 4.5 घंटे तक ही दे सकते हैं. तो हमें, अगर हम एक्ट फास्ट करेंगे, इफ वी विल बी एक्टिंग फास्ट ओवर इट एंड वी रीच दी, अगर हम इन सिम्टम्स में से कोई भी सिम्टम हमको महसूस हो रहा है, भले ही वो कम है या ज्यादा है, या वो थोड़ी देर में रिकवर भी हो गया है, देन ऑल्सो प्लीज रश बैक टू द नियरेस्ट हॉस्पिटल. हमको नियरेस्ट अपने सुपर स्पेशलिटी हॉस्पिटल कहीं जाना चाहिए, अपने आप को चेकअप कराना चाहिए, गेट योर रेडियोलॉजिकल इमेजिंग डन, एमआरआई या सीटी स्कैन करना चाहिए, रूल आउट करें कि वो स्ट्रोक है. अगर वो स्ट्रोक है तो हम विद इन द विंडो ऑफ 4.5 आवर्स वी कैन गिव द क्लॉट बस्टिंग ड्रग. और उसके देने से जितना हम जल्दी टाइम पीरियड में वो क्लॉट बस्टिंग ड्रग्स देते हैं, उतना ही जल्दी रिकवरी के और उतने ही ज्यादा रिकवरी के चांसेस होते हैं, एंड वी गेट द फुल रिकवरी. तो हम उस डेबिलिटेटिंग स्टेज से बच पाते हैं या अपने पेशेंट्स को बचा पाते हैं. अदरवाइज इट्स अ लाइफ लॉन्ग ट्रॉमा, लिविंग विद द डिसेबिलिटी, ट्रॉमा टू द पेशेंट, ट्रॉमा टू द अटेंडेंट्स. सो माय मैसेज is we should not ignore these symptoms, and we can very easily recognize them with Be Fast. It's easy to remember this acronym. It will help understand the symptoms, and you can easily reach your nearest hospital in time, so that we can do whatever to be done in this golden hour of 4.5 hours. Thank you, sir.
Thank you, Mashhad. I'm coming to Dr. Gore now. Sandeep, if you look at it now, that we talk about hypertension and diabetes are two most common things that are prevalent now. All our family, if you look at our family members, friends, someone or other will be having it. On the blood pressure part, because as we remember our medical school days, we always taught that a well-treated hypertensive behaves like a normotensive. So, coming from that adage, when should high blood pressure become a cause to rush to the hospital? Because sometimes people take it for granted and delay it. So it's a message that I would like you to sort of put it across, that at what pressure you should go to your nearest hospital.
Okay. So basically, when blood pressure causing a target organ damage, it makes a medical emergency. What kind of target organ? Blood pressure is high and patient is suffering with breathing difficulty. So it can be means normal blood pressure is 120 by 80. But if blood pressure is diastolic blood pressure is more than 90, or systolic blood pressure is more than 140, and if this patient having the target organ damage, if the patient having a chest pain and high blood pressure, if a patient having a blurring of vision and high blood pressure, a patient breathing difficulty and high blood pressure, patient with altered sensorium and a high blood pressure. So that makes the asymptomatic hypertension into the hypertensive emergency. And when these symptoms are there, the patient should immediately reach to the time. Because in emergency, I told earlier, I am reiterate for the audience who joined late, that it's like that ki, stitch in time saves nine. So if target organ is the damage is happening, then this patient should reach to emergency department as early as possible. So blood pressure, diastolic more than 90 or systolic more than 80 with target organ damage, that should be quickly addressed. And asymptomatic hypertension, if BP is systolic is more than 120, 180, and diastolic more than 120, and if patient is completely asymptomatic, that type of blood pressure one has to be totally evaluated. That is called as asymptomatic hypertension. But that hypertension also one has to thoroughly evaluate and treat, because it will lead to the target organ injuries.
Thank you. Dr. Sanjukta, you had a ER which is on the EM bypass in Kolkata, and if you look at it now, injuries, accidents, they keep happening. So, what is the message that you should take to give to people, that what immediate steps should you take during severe injuries or accidents? Because before they reach the ER, certain things, what are the messages that you can pass on so that they come in a much better shape than not being attended to?
Yeah, during an accident or injury, I would say when you are saving a patient and when you are retrieving a patient from the field, first is your own safety. Do not make two patients from one patient. So keep yourself safe. And then when you are thinking you are going to transfer the patient, just look for external bleeding. So this is one very important cause. The patients die on the spot because of bleeding. If you see there is an external bleeding, the best way of stopping that bleeding is direct firm pressure. So just use a clean cloth or something, put it on the bleeding site and press with your hands. If it is an extensive area, keep a tight bandage. And when you are giving pressure, please do not release the pressure to check. You hold the pressure and then you shift the patient. If possible, elevate the portion which is bleeding. And along with that, it is very important that we immobilize the patient. You just imagine you have got the chicken bone or mutton bone. If I just break it, how is the edge? It is so sharp, it can cut everything. So if I can see that there is a deformity over here and I am expecting that there is a fracture because it is bent like this, so definitely the edges are so sharp, it can actually cut your nerves, your vessels, your muscles, everything. There might be some damage during the impact itself, but it should not add up to the damage. Transporting the patient, while transporting the patient, it should not add up the damage and cut more tissues over here. So immobilize the injured area with whatever you have. You got a cardboard, you have got a scale, you have got a wood and stick or whatever. You just put it where the deformity is and tie it up. If it is two fingers, you can actually strap two fingers together. That is called body strapping. You can do the same with your legs. You can tie one leg with another. So that way you immobilize. If you are suspecting spinal injuries or injury to the board itself, you can actually put anything, any cardboard, any plyboard, and then strap the patient with this so that there is limited mobility while transporting. and reach the hospital. I always say this, that whenever you choose a hospital, whenever you choose an emergency department, choose wisely, because your trauma patient will definitely need much more than what you're expecting. If it is bleeding inside the brain, will need CT. If it's bleeding inside the belly or abdomen, he or she will need a CT scan of those areas. Might need to be rushed to the OT to stop internal bleeding and save the patient's life. You need a hospital or an emergency which has got enough blood bank support so that you can run it immediately. So the choice of emergency department is extremely crucial. The same thing as Dr. Rizvi was saying, in a stroke patient, you go to a nearest hospital, but it is not just any nearest hospital where you have got the facility of CT MRI 24 into 7, and you can send the patient for OT if it is a hemorrhagic bleed, or if it is with different kinds of bleeding, you have got thrombolytic facility. For cardiac, heart attack, you need a place where you can go for the cath lab. So here you reach a hospital which has got multi-speciality backup, and along with that, all these lab, blood bank, imaging, everything is available. And reach there and leave the rest to us.
Thank
So
you.
that's
Dr. Rizvi, I'd like to ask you is that seizures do happen, and in fact, how do you sort of assess someone having a seizure before medical help reaches? Because there's something that pre-hospital. So, if a patient has a seizure, any person has a seizure, what are the friends, relatives, or even bystanders? It could be someone going alone in a bus or a train and has it. So, what is the advice that you give to them? What to do?
थैंक यू सर फॉर आस्किंग दिस इम्पोर्टेंट क्वेश्चन एंड दैट्स ट्रू. अगर किसी को सीजर होता है, जो कि हम जिसको हम लेमन टर्म में इधर मिर्गी का दौरा या दौरा बोलते हैं, उसमें सबसे इम्पोर्टेंट है कि हम पैनिक ना करें. द वेरी फर्स्ट थिंग इज वी शुड नॉट पैनिक. कि किसी को दौरा पड़ रहा है तो हम पैनिक करें. उसमें दूसरी इंपॉर्टेंट चीज ये है कि हम सब जनरली देखते हैं कि जब दौरा पड़ता है तो बहुत ही फास्ट जर्की मूवमेंट्स बॉडी के हो रहे होते हैं, टोनिक क्लोनिक मूवमेंट्स जिनको हम बोलते हैं. तो उससे पेशेंट को अपने आप को हार्म होने के चांसेस होते हैं अगर उसके आसपास कोई एरिया ऐसा पड़ा है जिसमें उसकी वो कोई भी लिम्ब उसका टकरा सकता है या सर टकरा सकता है. सो सबसे पहला काम हमें ये करना है कि पेशेंट को अगर वो लेटा हुआ है तो उसको हम साइड में टर्न कर दें टुवर्ड्स वन साइड, ताकि उसका फेस टुवर्ड्स द ग्राउंड रहे, उसका एयरवे क्लीन रहेगा, वो चोक नहीं करेगा अपने ही सलाइवा से. जो कि हम देखते हैं सलाइवा या ब्लड ड्रूल करता है जब पेशेंट्स को दौरा पड़ता है, क्योंकि उनकी टीथ के बीच में अपनी टंग आ जाती है, क्लिंचिंग होती है. तो हम उसको सबसे पहले तो उसको साइड से लेटरल पोजीशन में कर दें, किसी भी एक साइड, फेस पॉइंटिंग डाउनवर्ड्स, माउथ, सो दैट का एयरवे हम उसको सिक्योर रखें. दूसरी इंपॉर्टेंट चीज है, उसके आसपास कोई भी अगर चीजें हैं तो हम उसको हटा दें ताकि उसको इंजरी ना हो पेशेंट को, जिसको दौरा पड़ रहा है. तीसरी चीज है, अगर कोई टाइट क्लोथिंग है हम उसको लूज करें, और खास तौर से अगर कोई गर्दन के आसपास, कोई नेक के आसपास कोई ऐसी क्लोथिंग है जो कि उसके ब्रीदिंग को हैम्पर कर सकती है, हम उसको रिमूव कर दें. एंड द थर्ड इंपॉर्टेंट थिंग इज, जो कि जरूरी है कि हम वेट करें बजाय इसके, आई वुड से कि ये तो वो चीजें हैं जो हमें करनी है. इंपॉर्टेंट इसमें ये भी बहुत ज्यादा है कि हमें क्या नहीं करना है, जो कि ज्यादातर लोग करते हैं. एज वो मुंह में कुछ चम्मच दे देते हैं, मुंह में कुछ चीज दे देते हैं कि उसको वो खुल जाएगा. वी एक्चुअली harm these patients rather than helping, क्योंकि उसको टूथ इंजरी हो सकता है, उसका कोई चोकिंग हो सकता है. सो what we should not do is, we should not put anything in their mouth. We should not try to stop those so called जो टोनिक क्लोनिक मूवमेंट्स होते हैं, जर्की मूवमेंट जो होते हैं, उन्हें हमें रोकने की कोशिश नहीं करनी चाहिए, बल्कि हेल्प ये करनी चाहिए, सर के नीचे कोई सॉफ्ट पिलो रख दें ताकि वो सर बैंग ना करे, आसपास का एरिया क्लीन करे ताकि आसपास किसी चीज को बैंग ना करे, लेटल पोजीशन में लेटा रहे. एंड वी शुड वेट कि वो हमारा जो सीजर है वो खत्म हो जाए. बिकॉज इन जनरल all these seizures ये अपने आप subside हो जाते हैं depending on some time. We should only take care of the time कि कितना time वो सीजर ले रहा है ठीक होने में. और जब सीजर ठीक हो जाए उसके बाद में हमें चाहिए कि पेशेंट को एक सेफ जगह पे, सिक्योर जगह पे उसको बैठा दें. एंड वी शुड वेट व्हेन टिल द पेशेंट रिकवर्स कंप्लीटली और वो अलर्ट हो. और एक और इम्पॉर्टेंट बात इसमें अलर्ट से मैं कहना चाहूंगा कि जब तक पेशेंट फुल्ली अलर्ट ना हो जाए कृपया करके उसको कोई पानी या खाने की चीज ना दें. तभी दे जब वो पूरा अलर्ट हो जाए. अदरवाइज हम अगेन रादर देन हेल्पिंग वी आर harming the patient because the patient might choke. These
Thank
are
you.
the few things which I would like to understand.
इनफैक्ट बचपन का याद आ रहा है कि जब जो
जी
आप गाना गाते हैं ना, लास्ट वर्ड से फिर नेक्स्ट गाना शुरू होता है, अब चुप बोले. सो
जी
आई एम कमिंग टू यू नाउ बिकॉज choking is something that can is life threatening also. We, if you recollect, long time back, we lost a senior FO's officer from choking. Sanjukta may be knowing it from her state. What are the simple life-saving steps to perform when someone is choking? This is important for public at large because it can happen anywhere. It can happen at home. It can happen while in the school, while someone is traveling. You see someone choking. What is it that your advice should be there to them? How to tackle it? Because
Okay. This choking is as it is a very important and topic, and we also saw one of our senior colleagues son died due to this choking episode. So it's very important to understand what to be done exactly when a choking happens. So first thing we have to prevent these things. Many times nowadays we see kids throw the some candies and they try to catch into the mouth. I think that practice they should stop, and we should make a public awareness that this is a very dangerous practice. This is not the sport. It can be very dangerous thing. So this message we have to give. And when they are eating a bony object or any hard object, so they should be very careful about that thing. And if a choking happens, first sign will be a patient will start cough. If a choking is mild, we should go ahead and encourage the person to cough out that thing if a choking is mild. And if it's a severe and the patient is turning blue, at that time one has to stand behind that particular person and encircle that person with both arms with tight fist above the navel, and we have to give the upward thrust. So that will help out to bring that object outside. And in any point, if patient become unresponsive and if pulse is absent, that time one has to go ahead and start the CPR. And during the CPR, we have to focus on breathe also, because this type of arrest are to the respiratory arrest. So basically, if choking is mild, we should encourage the victim to cough out. If patient is coughing and he is able to speak, then we must encourage him to cough out. If he is not able to speak, so means that make a severe obstruction, and in that thing we should do Heimlich maneuver. I think if somebody go and watch on go that particular Heimlich maneuver, then that will be a very good. But I will explain. One has to stand behind the victim and encircle the arms again against their tummy and put the fist above the navel, and we have to give the upwards thrust. So that will help that particular object to come out. And most importantly, at any point, patient will become unresponsive and patient become if pulse is absent, then one has to go ahead and start CPR. So that is these things, and this is a medical emergency, and public awareness is important, and I think we should be doing more awareness in this regard to prevent that particular because the choking can be life threatening.
thank you, Sandeep. Coming to Sanjukta, is that you are in a hospital which has one of the best pulmonology setups of Fortis Healthcare, and so I'm coming from that specialty. What should you do during an asthma attack emergency? Because there's something that can happen. So if it happens, what is it that the patient if he or she can sort of do herself or himself, or the relatives what they should do, any bystander.
Yeah, if the patient is already asthmatic and they know they are having asthma and they are prescribed from asthma, so the diagnosis is clear, and any allergic stimulus or something has, caused this exacerbation of asthma, this asthma attack, then everybody should keep calm, and the patient also should be kept calm, and just help the patient to be upright, because that is a position when it is easier to breathe. And if that person has got bronchodilator inhalers already prescribed, help him to use that inhaler, because it will reduce the symptoms. And if the symptoms still persist, definitely this patient needs to be in a hospital for checkup. And one other thing I would like to say, that though we think this patient is asthmatic and having an asthma attack, could be something else as well. Asthma attacks means we are having, the patient is having shortness of breath. Now, this shortness of breath, if it is in a non-asthmatic patient, so who never had shortness of breath before, take it as a red flag sign and reach the hospital immediately, because it could be a heart attack, it could be other pulmonary issues, it could be something else, and which could be life-threatening. And again, the golden hour would be very crucial. If it is known asthma attack, the patients usually know their pattern. If it is something different, this time if it is associated with fever, cough and sputum, or severe shortness of breath, saturation going down, so please reach a hospital as soon as possible. And in the modern day, especially after COVID, we are very happy that most of the patients has got the pulse oximeter. It is very wise to keep that pulse oximeter in home if you are asthmatic. And just remember this while transporting the asthma patients, or also the COPD patients mostly, do not give too much oxygen in the ambulance or whatever vehicle you are coming with. Just give oxygen which is keeping the saturation to around 90-92, and that would be okay for this patient. Reach the hospital, and the rest will be taken care of by the doctors.
Thank you, sir. So, Dr. Rizvi, coming to you as the last question is that how do you manage uncontrolled bleeding and know when to seek urgent care? Because this is a question for the public. If there's a bleeding that's uncontrollable, they feel what they need to do and when do they need to seek urgent care. They should not be sitting idle. What are the things that they should be doing to help that patient who's having this, the person, that individual having this uncontrolled bleeding?
Sir, as Dr. Sanjukta has just now said, the very first thing for any external bleeding which we can see is the pressure bandage. Apply some clean cloth if you have, or apply the bandage and put a pressure on it. Keep it at least 10 minutes. And don't, as Dr. Sanjukta has already said, don't try to see whether the bleeding has stopped or not. If you feel the soakage is there, apply more bandage. You can apply more bandage over here. And as she has already said, try to, if we can, try to elevate the limb over the, I mean, the level of the heart, so that it little bit slows down the bleeding. And as far as the urgency is concerned, when to reach, so if there is severe bleeding, if the wound is large, if the wound is deep, if it is near the dangerous areas, neck, chest, or abdomen, if there is a spurting blood means वो पूरा फाउंटेन की तरह से ब्लड निकल रहा है, इसका मतलब है कोई मेजर आर्टरी उसमें इन्वॉल्व हो गया है। तो ब्लीडिंग स्टॉप करने का, तो एक्सटर्नल ब्लीडिंग का तो बेस्ट तरीका वही है कि हम उसको प्रेशर बैंडेज दें, और उसको सोक हो रहा है तो कीप ऑन पुटिंग एडिशनल बैंडेजेस, एंड वी शुड रीच द नियरेस्ट हॉस्पिटल, super specialty hospital, as Dr. Sanjuta had said, where we can transport the patient immediately to the OT if required. We can do all major surgeries. We can look after all organs. We have got super specialties there. And when there is a severe bleeding, we should always look for the danger signs. वो जो पेशेंट शॉक में अगर जा रहा है उसको मैनेज करना, शॉक को समझने के लिए जरूरी है, जिसका वो अर्जेंट केयर जिसमें जरूरत है वो है कि पेशेंट को अगर कोई लाइट हेडेडनेस हो रहा है, कोई कंफ्यूजनल स्टेट में हो रहा है, पेशेंट की पल्स इज गोइंग डाउन, so we should understand that the patient is going into shock, reach the nearest super specialty hospital and take the urgent care, so that within that golden hour, which we all of have said, just first hour is critical. So within that golden hour, we can look after the things. We can do all resuscitation and then shift the patient to OT if required.
Thank you. But I'd like to thank all the three panelists for giving a lot of insights for the public at large on how to handle and how quickly you should reach a emergency medicine facility, a hospital, and before you reach it, what all you should be doing, and recognize symptoms as was mentioned about before stroke happens, before a heart attack happens, blood pressure is going up. What all needs to be done? It's a very nicely that has been captured by all the three panelists. I would like to thank you. And on behalf of Fortis Healthcare, again, I would like to stress that emergency medicine is something that we're putting a lot of stress on, and the public at large must know that if they have any issue, they must reach out to the nearest hospital which has emergency medicine, because please don't delay. As was mentioned earlier, the golden hour is very important. Any delay can be life threatening, can also be injurious to health also. Like a stroke patient, if you reach much later, you you will survive, but you'll be paralyzed, you will not be talking. So it's a pain for you, for the family, for everyone. So this is something that we ask each and everyone. And on that, on behalf of that, I like to from Fortis Healthcare say thank you to everyone. Namaskar.
Namaskar.